Good morning. My name is, as Ken mentioned, my name is Joe Gonzalez. I'm the director for the Area Agency on Aging of the Lower Rio Grande Valley and also one of the departments of the Lower Rio Grande Valley Development Council. This morning we have two of our areas that are going to be covered. One is Health and Human Services, and then the second one will be Economic Development. For those of you that are here for Health and Human Services, I asked them maybe want to stay for the Economic Development section also. And the reason is because everything actually affects economic development. If it's healthcare, you're looking at healthcare costs, training, job opportunities, jobs, so all that affects economic development. So, I ask that you stay also for that section. As we plan for the next, legislative session, as Ken mentioned, the strategic plan actually works well for other agencies. If you don't have your own strategic plan, you can look at what's on the current document, and if it's not there, you have the opportunity to add to it. There is a blank page in the back that's to add a new area, new goals, tasks, and also appreciate if you also add the resources that you think will be used or needed to carry on that goal. The strategic plan there are different sections, and one of them, of course, is a regional description. It describes the valley, the whole valley as a whole, our geographic area, our population. Population that's entered in the plan is based on the 2010 census figures. One of the things that I was looking at, and I'm sure, I don't know if some of you may have seen on the transportation infrastructure, it doesn't have the 69, the I-69 designations, 69C, and I think the others are D, F, and also Interstate 2. So those sections will be, changed on the plan to indicate the new highway designations. One of the things that we'll ask for you to look at is actually on the vision statement for the region. I'm showing my senior moment. I'm taking my glasses off. Our vision statement is that Lower Grande Valley has established itself as the front door to the global marketplace because of its strategic location between Mexico, Canada, state of Texas during the planning process. It has establishing our goals and objectives. But as we look at our vision statement, is as the international front door into the global marketplace. The Lower Grande Valley is committed to ensure regional prosperity and sustainability to all sectors and enhance the quality of life and security to its residents. I think that this, resonates, year after year as to the vision of the Lower Rio Grande Valley. Are there any questions on that or recommended changes? One of the things that we always dependent on technology, right? Sometimes it doesn't cooperate. Okay. One of the items that we have, and I'm sure that, talking with some of you, might be some changes. And this is on our trends, and these are the valley trends. They're similar to national trends, but this was actually the trends for our area. I don't know if you all have had a chance to look at our trends of diversified international markets, recognition of tourism as a growth industry, increasing tax burdens, increased technology capabilities, needs, small businesses remain as primary employers. Just finished the rest is increasing governmental regulations, rising comprehensive public health care needs for a growing indigent population, diversification from an agricultural base, and the region continues to experience brain drain as college graduates leave the region for better jobs. And this is leaving the region for better jobs out of the valley into other parts of the state or the country. Are there any additions or deletions that you all might recommend? Leo?
On the increased need for public transportation, I think there's an increased need for coordination of the three county public transportation supply providers across the service lines. Meaning you have three different public transportation providers, and there's need to be coordination between the transportation services so you can get in one place and be able to move through the counties to the location that you're trying to get to. We have a degree of that, but it still needs to be much, much more.
Okay. Could that be part of the trends, or could that be one part of the challenge?
Well, if you put it as a trend, it would be the need for, increased need for coordination of services across county lines. Public transportation across county lines. You could put it at any where you think it's more appropriate, okay? But I think that needs to be.
It needs to be stressed in the plan.
Yes.
Okay.
It can be a trend, but I also think that it's a challenge
Okay.
because coordination is not really happening right now. So we need to make sure that that is in a challenge too, because you're working with three different entities that are run by three different basically municipalities. And when that happens, sometimes there's a lot of competition and you're not necessarily working together for the writers.
Okay. So Leo, your recommendation is the trend would be increasing need for infrastructure, public transportation, maintenance, and coordination?
Basically the coordination of it.
And I think, Mr. Gomez, you had some comments?
Yes, what I wanted to say is, since transportation is going to be making a presentation later on, maybe we need to make them aware somehow that this needs to be part of their plan also, because they'll be more involved with it than, an agent. And
Right.
I understand that agent, because of the folks that use the bus system, it needs to be part of the plan for agent, but at the same time, it also should be part of the plan for transportation.
Right. So, Leo, that would answer, I guess, your recommendation about adding coordination as part of the trends, and maybe adding that as one of the also challenges, because as you mentioned, I think that is a challenge that's facing the region on transportation services. Any other recommendations on the trends?
Okay, the recommendation on the trend has to do with the high teen pregnancy rate and the second repeat pregnancy within 6 months. Okay, that's a concerning trend for the area.
Okay. Okay, I think did we get that? Okay. And we also, recording, hopefully we can, pick up, this, but do, appreciate that's why we're here, is to get, public input. Anything else on the trends? Just as we look at both ends of negative and positive, yeah, there are some assets that we do have, in our region. And those are on our next, and those are the assets and challenges. On our assets, if you can look, part of it is one of the geographic location that offer economic opportunities, human resources.
Joe,
Yes.
are we supposed to be using the screen? Yeah.
Okay.
There you go. We can follow it.
Yeah. Okay. There you go.
There you go.
It's there in the screen, and I'm sure, if you've got a copy, you'll have a hard copy. Human resources, abundant trainable workforce, young workforce. Our infrastructure, ports of entry, shipping ports, rail, airports, highway systems, public transportation, assisted living facilities, healthcare facilities, availability of land and development, natural resources, quality of life, recreation, tourism, intergovernmental cooperation, cultural diversity, climate, availability of educational and technical institutions, multi-commodity international agricultural industry, growing education infrastructure, improved educational attainment in the 25 years and younger category, and community involvement. These are the assets for our region. There any comments or changes or additions, deletions?
Just because it's a recent change, maybe you should add the medical school.
Okay. Can that be covered under the growing education infrastructure?
It could, but I think the specific of a
Specific?
medical school is
Okay.
really, really important.
Okay. And one thing that, I think we will do also, and we can do that in all our goals and strategies and, tasks, and especially where we have the resources for each of those goals and objectives. Wherever we are, I guess, mentioning UTPA, we'll change that to the new, UTPA health systems. That way we'll be consistent with everything that, all those changes as you mentioned, Leo. Anything else, any additions to the assets? Okay. Challenges. I think, Leo, this is where you had a challenge for transportation.
Yes.
You want to restate the challenge or?
Need for coordination of, really, it would be the need for coordination of transfer points between the 3 public transportation providers in the 3-county system.
Okay.
That's where we're having problems, where you're moving on one system to another system, and for it to be such that a person doesn't have to wait another hour to get to the next bus to try to get where they want. So they need to coordinate the times of transfer.
Okay. Let me change this over to the challenges. Are there any other changes? You can see our challenges for our area being in the unemployment rate, raw water quality and quantity, our infrastructure maintenance and expansion of drainage, roads, highways, water sewer treatment plants. Go ahead.
Mr. Gonzalez, I wanted to propose that we add in the challenge the coordination of services for individuals and families affected by trauma, to include families, foster children, foster families, disaster workers, and peace officers. And the reason why I believe this is important is we all know the increasing number of veterans in our area, but also DHHS is under sunset review, and they have cited many concerns having to do with the constant placement changes of foster children, meeting their emotional needs. And we need to remember, as corny as it sounds, these children are our future. And if we look at the effects of trauma and PTSD on children, veterans, families, and disaster workers, we're looking at health issues that affect the entire community.
Okay. Appreciate if you have your notes of those changes, if you can, turn them into us, it'd be great. And I think one of the things that occurred to me, as you were talking about that is, we've been hearing this in the news, and that's affecting our area. It's all the children that are the undocumented children that are coming in, and I don't know if that can be as part of what, you're talking about also.
Yes, absolutely.
Okay. Okay. Any other changes to the challenges? Leo? This is your opportunity.
Yeah, here's your opportunity. I think we have a challenge on the funding for advertisement of public transportation. I know that when we have had hearings, there are situations where bus actually goes by a certain place that they're requesting for additional services. They simply don't know that the bus goes by there. And that is due to the fact that there's very little money available for the advertisement of public transportation services. And so therefore, the community doesn't know what to do, where to go, which routes go where, and all that type of information. And all of that is due to the unavailability of money for the purpose of public transportation needs.
Okay. So that would be a lack of public education on transportation services? Okay. And I think you might have some more input into the services, once, there is, I think it's tomorrow, on a transportation section. I think it'd be good to, provide some input into that area also. Okay.
I think that we must create a committee to look into that, educating and cutting out. So, your comments.
Okay. Any other changes, any more additions to the challenges? We are a growing region, and our challenges are going to be increasing. Okay.
Joe, 2 years ago, we were talking about the illegals.
Uh-huh.
We've been trying to get a right term for them. I don't see it on the challenges because that's a big issue now with immigration.
Yeah, that's why I was mentioning one is what we've been listening in the media lately about, the number of undocumented that are being, apprehended, and how many of those, are children, unaccompanied children. And also, yes, the number of those undocumented that are really affecting the region. And so, we'd like to add something to one of our challenges.
Addressing the need to address the immigration reform issues and the population.
Okay.
The increasing population.
The increasing population. Okay. Thank you. Any other changes, Leo?
This one's going to sound a little bit weird, okay, and I'm not sure how or whose responsibility it would be. It may be zoning or something in that area. It has to do with the integration of vegetation like trees in construction. Say, for example, you have Austin, you go to any of the areas, there's lots of trees all over the place. Over here, you just have bare spots where, the heat is really, really bad because it's all reflecting off of the surface of concrete and all that. And I think that in our development, we don't include the idea of having trees within that development. And I think that that would really help the area if we do things like that. So I'm not sure where or how to state that, okay, but it has to do with the structure. And since we're going to be having more and more because of our growing rate, I think it's important to consider that as part of the things that we do as a community.
Okay. You know, one thing is maybe I want to recommend, and I think that might be part, I think there's another section on the strategic plan on environment. And I think that could be a goal and objective that can be added to that section, you know, on the environment. Because yeah, that's you know, that's a big you know, issue, especially like say the freezes that we had experienced, and the, you know, the uprooting of all those, you know, citrus trees, and then nothing else replaced it. Might have to have a more active Audubon society.
You could call it a loss of green space. That's kind of what you're talking about. If it's loss of green space, you're seeing all over.
Okay, then that could be a, you know, a challenge. We can put that as another bullet as the loss of green space. Okay. Thank you. Okay. Anything else? Challenges? No. Now we are moving to the main, which is our goals and strategies and our accomplishments. On our Health and Human Services section, I think we had on our page, beginning to the different areas that we have for us. Has to do, you know, with health. Our service goals that we have are, there we go, is develop a comprehensive network of public-private service delivery systems and that promotes healthy communities, increase professional volunteer opportunities to utilize the wealth of experience and talents available in the community, identify and enhance a network of public-private service delivery systems. Well, I think that's repeated. Is to identify, the other one is develop. Promote regional services for veterans in South Texas, improve mental health status in the Lower Grande Valley, improve substance abuse services for prevention and treatment, support and improve maternal and infant health issues in South Texas, use of ergonomic safety approaches in promoting healthy and safer working conditions for farm workers in the region, improve health of farm workers, primary and secondary prevention, assess and improve farm workers' living standards and access to medical care, improvement health, farm workers, primary and secondary prevention, develop a plan for livable communities for all ages. Our current accomplishments is that the Lower Rio Grande Valley Development Council is also the designated Aging and Disability Resource Center for the Valley, and you know, we have our website, which is our networkofcare.org. And actually the name of our ADRC is RioNet Aging and Disability Resource Center. The Development Council is also the CBO for Community-Based Care Transitions Program, you know, under Section 3026 of the Affordable Care Act, with the Centers for Medicare and Medicaid Services was our primary goal of the reduction of the 30-day readmission rate, hospital readmission rate. That's part of, you know, our accomplishments on the Health and Human Services.
Can I make a comment?
Sure.
On the RioNet Network of Care, do you know how many people are accessing that information? Because just as a comment, it's not really user-friendly.
Okay.
I know I mentioned it earlier, so I wanted to make that known that it's not user-friendly, and I just want to know how many people are actually accessing the database.
Yeah, okay. Don't have that information with me on hand, but I can get that to you. Okay. And we're in the process of reevaluating the use of that, or looking at some other system that might be a lot friendlier. to use. Our first goal is develop a plan for livable communities for all ages. Our objective is assist local communities to develop a plan to meet the impact of an aging population and maintain the infrastructure for all ages. It is work with local community leaders to assess the resources within their communities, work with local community leaders and private sector to develop local plans, provide training and technical assistance to local community leaders to address different aspects on the impact to their communities by an increasing aging population. Our measurable outcomes for a specific goal are the strategies are work with local community leaders to assess their resources within their communities, work with local community leaders and private sector to develop our local plans, and provide training and technical assistance to local community leaders to address different aspects on the impact of their communities by the increasing aging population. As we have as our potential resources, as the COG, the area agency, our local counties, municipalities, universities, private sector, state, federal agencies, school of rural public health, community health centers, promotora programs, and private clinics. Are there any changes or additions to this?
Mr. Gonzalez, would it be appropriate in this particular area to add to the aging populations with challenges and disabilities?
I think so. And that would be part of the objective,
Yes.
where it says infrastructure for all ages and
The impact of an aging population as well as populations with challenges and disabilities.
What do you mean by challenges,
People use them interchangeably now. Some people say individuals with disabilities, and some of the scholarly literature says individuals with challenges. It's just different terminology, and that's why I use both.
Okay, why don't you just leave it with people with disabilities then?
Because in some areas, in some professional circles, disabilities is now frowned upon, and we're using the term challenges. That's the only reason.
No, I understand.
I'm trying to be inclusive.
I represent the disability population, but I'm just saying, like, what
Okay.
is news in the area, I guess, 'cause it's for the 3-county area.
Okay.
okay. If you can add, give us that change so we can make the appropriate change to it. Any other changes to this? Our second one is the goal is use of, let me change it. This is page 16. Goal is the use of ergonomic safety approaches in promoting healthy and safer working conditions for farm workers. Objective is improve health of farm workers through primary and secondary prevention. It is assess farm worker awareness of occupational safety, especially ergonomic practices, discuss findings with farm workers, healthcare providers, community organizations, and health policymakers. Develop educational informational materials on farm workers, seek funding to support pilot programs and evaluation. Our measurable outcomes for this specific goals, our one is to have improved economic safety for farm workers. Our strategies is, assess farm worker awareness of occupational safety, especially ergonomic practices, discuss findings with farm workers, healthcare providers, community organizations, and health policymakers, develop educational informational materials on farm workers, seek funding to support pilot programs and evaluation, create a smoke-free workplace that will protect employees and benefit businesses by cutting down on costs of health and insurance benefits. Our potential resources as we have here is Texas American Council, Lupe, South Texas Center, Department of State Health Services, American Health Promotion Milagros Program at SDC, Farm Bureau, USDA. As you can see, those are the other potential resources there. Are there any changes to this? Leo?
Joe, this is more of a question. The number of farm workers have actually been going down throughout the years, okay? And my comment is more in terms of the general population and the goals that are identified in this sections and the following sections regarding farm workers are also affecting the low-income population. And I don't know that it would be appropriate to make changes to this thing or simply to incorporate the idea that the same goals that we are trying to reach for farm workers are also needed for the general population.
Okay.
So to maybe amend the wording in such a way as to be more inclusive rather than restricted to farm workers, especially since the number of farm workers have actually gone down and have been going down.
Okay. So it can be working conditions for farm workers and,
Low-income populations are really, it has to do not just with low-income population,
Yeah.
it has to do with the general, across the board.
other working conditions? Sir?
I think that's really important because, I mean, I even see it at the university where ladies and students begin to have problems with their wrist because of the computer and don't have the right, you know, seats to sit in and, or their back hurts.
Right.
So I was looking at this one plus, I think 2 pages or 3 pages down.
Right.
You also talk about the use of ergonomic safety approaches to promoting health and safety working conditions for the region. So those two are kind of go hand in hand because I think it's in general for everybody, not just
I agree.
farm workers.
Mhm.
In the office, in the restaurants, in construction, in the farm as well.
Right.
I think that would be better to, or wiser to make it more general.
Okay.
Maybe combine it with the one that's about 3 or 4 pages down there.
It's an issue that applies to the whole working population, okay? I mean,
Oh, yeah.
it's just.
Right. Yeah, if you work in a recycling center, you know, you're dealing with different, different products that, you really don't know how safe they are.
I just have a comment. That would also work really well with the next section, which is economic development, workforce, and job training, because that can be incorporated into the job training programs, since this is like for the working population.
Okay. So how do you want to reword this? You still want to leave farm workers or just leave?
That's up to the pleasure of the group. I'm just saying that it needs to be more inclusive, okay? That it
Right.
needs to include the entire population, not just farm workers.
Yeah, pesticides doesn't necessarily have to do with pesticides out in the field. I still see farm workers, harvesting some of the, other products such as, aloe vera. You see the, harvesting that or harvesting citrus and other agricultural products. But I can see also, the fact of, working in those, like I mentioned, recycling center, or like say, the restaurants, being the safety of, don't burn yourself.
May I propose a solution, just hearing everybody's comments? How about just amending it to say, improve the health of all employer and worker populations through primary and secondary prevention, including addressing musculoskeletal and soft tissue injuries?
Yeah, that sounds really good.
Okay. That would be the objective, or that would be the goal?
That would be the objective.
Objective. Okay, no, that's fine. So that means you would have to reword
Right? You have to reword the goal.
Okay. I guess we can look at that and see how we can, we can make that appropriate change and still maintain the same.
Replace.
On that goal,
Uh-huh.
whatever you said out there for, like 2 words or what have you, Just put it on the goal there, instead of farm workers, she said something after 4,
Right.
2 words. And then the rest could be added into the objective.
Okay,
That is correct.
okay. Yeah, that's why I'm asking if you write it down, if you can give it to us.
Absolutely.
That way we can, we can make the appropriate change, and we can look at those words and make those changes to that section. Thank you, that's why we're here, is get your input. And I think we can do that to the next, for the next 2 sections
Yes.
that have to do with that, okay? Okay. So if not, maybe we can move to the other parts. We can move over to page 19. And the goal is to, let me move the change over here. Yeah. And I'll take a look at those 3 pages that have to do with the farm workers and make those changes.
Did we skip, no, but 18?
Okay. Yeah, was there a change?
No, I think you need to go over page 18.
Page 18, okay.
It changed over from farm workers to the.
Oh, health and communities, okay, that's okay, page 18, the goal to develop a comprehensive network of public-private service delivery systems that promotes healthy communities. And this is maximize coordination and partnership building between federal, state, and local agencies or employers. Our strategies, that we have are, support the continuation of a standardized set of data to be used by public and private sectors for service delivery, and I think that's still part of what, we're still working on. Support the expansion of a regional information and referral system. We do have a 211, and part of also, we have our Aging and Disability Resource Center for that. Develop a free consumer-friendly resource guide to aid the community to locate specific services. And the next one is develop family education programs that facilitate and promote self-help in managing stressful situations. We have all the, potential resources. Are there any changes?
I would like to add to the last bullet point under strategies, where it ends stressful situations, I would like to add comma, traumas, comma, and critical incidents.
Okay. Got it? Okay. Any other changes? Leo?
This is not so much a change, it is more of a suggestion. You're going to have a medical school, you have Dr. Renson Hospital, which will be the teaching facility. You have educational institutes that are going to be doing a lot of research concerning health issues. But what usually happens with the educational is that they do their research, they publish it, and then nobody ever hears anything. And I think that there has to be something in here about sharing that information on a local basis so that it has an impact. Not just do research for the sake of research, okay? I think there are avenues that are available for the integration of that information into the community so that that information can become relevant to the population. So I don't know that that would require including something in here, but I think that it's important to emphasize the need to have that information available to the community and to be published within the community. That we have different groups, okay,
Yeah.
different coalitions where that could be accomplished.
So it can go from shelf to practice?
Yes.
Right.
Yes, that's excellent. That's excellent.
Okay. We'll see how we can add that. Yeah, that is true. We have, we have studies and, and evidence-based interventions and projects and end up in a bookshelf. You know, I always say, so we can go from bookshelf to practice, that'd be good.
You could say, based on what you were just saying, integration of medical and health research into practice.
Okay.
Because that's really-
Yeah, that would be a general,
A general way to.
yeah,
So that could be an additional bullet.
yeah, in addition.
Okay, so, could you please repeat that?
Integration of medical and health research into practice.
Okay. Okay. Okay, that's good. Anything else? No, so we can move over to 19. Yeah, I need to move because I think we have enough time. The next one is our goal is to identify and enhance a network of public-private service delivery systems to promote healthy communities. Objective is to coordinate the identification of social infrastructure needs, including but not limited to nutrition access, social services access, preventive health care, emergency health care, and just general health care. With our strategies is to conduct public forums to identify regional needs, identify projects that meet those identified needs, and develop a comprehensive service delivery plan that incorporates service integration. Are there any changes, you know?
Joe, you could include some information, like right now we have some farmers markets that are occurring throughout the area. Just a general statement of supporting efforts like farmers markets to make the availability of low-cost, healthy food to the community. Just a general idea that that's a good idea by having it in the plan and encouraging that kind of activity within the community.
Okay. So there'll be an additional strategy. You want to add to that?
Yes.
Okay. Page 20, our goal is to develop a comprehensive network of public-private service delivery systems that promote healthy communities. The same goal, a different objective is to identify and develop programs to prevent, reduce, and control type 2 diabetes. And our strategies are to assess current programs in the region and elsewhere, discuss findings with community organizations, schools, healthcare providers, and policymakers, develop informational materials on diskettes. Well, might need to change those for the general public. Seek funding, support preventive efforts, support the development of a regional diabetes research institute. Sure.
I'm part of the regional CHIP and Medicaid Advisory Committee. And I'm aware now that the managed care organizations are developing diabetes programs to their clients or consumers.
Their members?
Yes, their members. So instead of reinventing the wheel, I think we need to coordinate with them to see what type of programs that they're offering to their members.
Okay. So that could be another bullet is coordinate, educational efforts with the Medicaid, the MCOs. Yeah, it would be with the managed care organizations.
Just in your potential resources, there are other groups, for example, the Juvenile Diabetes Association.
Okay.
That could possibly be listed, Rio Grande Valley Border Health Coalition Choices, just different things, you know, because we need to point in this kind of a document, potential resources out that maybe people don't know about.
Okay,
And
of course.
I think that would be helpful.
Okay. Yeah. Anything else from the community health centers? Any comments?
I think we're all sitting over here and everybody is kind of like on the same page over here.
Okay. Okay, any other changes, comments? Nope. Okay. Page 21. And I think this is where we may, what you were mentioning earlier, on the goal is use of ergonomic safety approaches and promoting healthy and safer working conditions for the region. With the objectives is improve health for the regional workforce through primary and secondary prevention. Our two strategies is use ergonomic approaches developed by the Centers for Disease Control and Prevention to evaluate and improve local practices, and create a smoke-free workplace that will protect employees and benefit businesses by cutting down on cost of health and insurance benefits. I think, Leo, this could be also the right section to add what you were, and also, what you were also mentioning earlier on, just for the workforce, in general, the safety conditions. So I don't know if you want to add that same bullet to this section. The safety, safety working conditions. Any comments on this area?
On the second bullet,
Yes.
create a smoke-free workplace. I would suggest adding create a smoke and drug-free workplace.
Okay.
I think that'd be important. It's not, and we have a lot of signs, even at the university, no smoking, things like that. I think it's important to also take
Okay.
and promote that.
Got it. Smoke and drug free. Okay.
Great.
I just have a comment.
Lucy?
Regarding workplace injuries, do we have or do you have information regarding, like in this region, what kind of incidents are there in workplace injuries?
No, but I don't know if that's something that, we can approach state health services, where they might have some of those statistics.
There is OSHA data by regions, and the basic main causes of injuries are the musculoskeletal and soft tissue injuries. And OSHA has been having a lot of impact on trying to get those programs changed and revised. And nowadays, you'll see that many of the orthopedic surgeons, rehab facilities have included ergonomic training and all of the work-related strengthening programs and conditioning programs. So OSHA would have a lot of that data, but definitely the trend is on musculoskeletal and soft tissue injuries.
So OSHA would be we could try that. Pardon me?
It's a good source because that's who the employers have to report their injuries to.
So we could try to see.
Yeah.
Okay, good. Thank you, that's good, that's great information.
I just have a comment, maybe she would be able to answer it, but not everybody reports to OSHA because there's different occupations. So would there be another resource, do you know?
What about Texas, Texas, Worksman?
Yes, Texas Workers' Comp.
Okay.
But you're making a good point, if it's reported.
Yeah,
Right, that's
exactly.
the good point.
Not everyone reports,
Exactly.
a broken leg or,
Yeah.
okay. Any other comments, discussions, changes? No? Okay. Page 22, the goal is support and improve maternal and infant health issues in South Texas. Objective is use healthy mother principles to assess services and suggest improvements. I have 4 strategies: is assess current services and health education approaches, discuss findings with healthcare providers, community organizations, health policymakers, develop informational materials on maternal and infant services, seek funding to support pilot programs and evaluation of specific issues. Example is autism, early onset of diabetes. Are there any comments, changes, deletions to this section? Leo?
It's just a comment, Joe. There's some newer programs. You mentioned Easter Seals, ECI, but there are some new programs. Like, for example, there's one from Yale University in collaboration with Doctors of Residence Hospital. I can send you the name of those
Sure.
to include in this thing, because they're new programs that most people don't know about.
Okay,
Just
appreciate it. Okay. Any other comments or any changes to this section? Oh, okay. Moving along. Page 23, goal is improve mental health status in the Lower Granite Valley. Objective is maintain and upgrade mental health services appropriate for the population. Our strategies are develop a handbook of services available and credentials of staff, types of clients, etc. Discuss findings with mental health providers and policymakers. Obtain and disseminate educational materials on mental health for general public. Seek federal and state legislative support for implementing process. Seek other funding opportunities. Assess and develop programs, facilities for vulnerable populations, example of children, veterans, for the Rio Grande Valley. Recruit mental health providers. Provide mental health services to brain injury or brain surgery victims. Any comments, changes? Melissa?
I think we need to add the component to, like you're saying, to maintain is to provide up-to-date training on new strategies in the mental health population. What's happening is that a lot of our mental health providers don't get enough training, and it's maybe once a year, or only certain people go to training, so we need to emphasize that here.
Okay. So you want to add that as another bullet? Okay.
I think the other thing that might be important to add would be you don't have stability on the doctors that are assigned for, like, for example, Tropical, Texas, so that when a patient needs medication, they can't do the prescription because there's no doctor that's available, and that creates a major problem in the service to this population because they have to go without medication for a long time. And I think that that's really important to have that, something like that, in relationship to that particular stability, or to have a strategy for when they have a vacancy of a doctor to be able to access medication for the population.
Okay. So that would be another, Leo, that would be another bullet you recommend to add to that? Okay. Any other changes, comments? The other goal is improve mental health status in the Lower Rio Grande Valley, maintain and upgrade mental health services appropriate for the population. Strategies are discuss findings with local organizations and policymakers, encourage public participation, seek federal, state legislative support for preventive programs and other funding sources, train peace officers to become licensed as mental health officers. Any comments, changes, deletions to this section? Lucy?
I think part of the problem with mental health is that we need more education, because I think that right now is a stigma, and a lot of the clients will not access mental services because they view it as, I'm not crazy, it's like a taboo, and I think we need to do more education, because there is a lot of need out there, but, patients will not access it. And I think part of our strategies should be some sort of an educational campaign for, our general population.
General education on awareness on mental health issues. I guess it's the stigma of being labeled. Okay. Okay. If you have some, wording you'd like to recommend, appreciate you can give that to us. It would help us in putting that additional bullet. Any other changes? No, okay. Now on to substance abuse. I have, yes, sir.
It's just something for the need of clarification. Improve mental health status, what does that mean in the Lower Rio Grande Valley? Does that mean that we want to get more persons with, it's just, in other words, what does that statement mean? And I think it needs to be a little bit more clear. I'm looking at page 24, Joe. At the
Okay.
top, the goal.
On the goal.
What is it that you're trying to do? The word status leaves a lot of room for interpretation of different.
Okay. This was a section that was added by, I'm not sure whether it was Tropical, Texas, at our last meeting that we had about, Manuel, it was 2 years ago. And so that was what their recommendation was as a goal. So for that,
Right, and that's why I think they mean something like improve mental health services instead of statuses, okay?
okay, but we can change that.
Yeah.
Okay.
Yeah, well, that's what I'm saying, see, I'm not sure what they meant, and that's what's wrong with the statement.
That'd be services or awareness,
Exactly,
but making it that as awareness?
right.
Okay,
It could be any of those, and so,
okay. Yeah, we can substitute status for awareness.
Yeah, I was just saying that maybe one can be awareness and one can be services.
yeah.
Okay.
And that way you have two separate,
Why don't we just say increase mental health, increase awareness of mental health services? We go making people aware and then identifying the need for mental health services.
That-
I think people are aware of the services, it's more the stigma that they're having to deal with.
yes.
Yeah, but this particular goal, if you'll see at the bottom, discuss findings with local organizations and policymakers, it's talking about services and behavior.
Defining how many people have mental health issues in this area.
Number two, on page 23, you also have the goal is improve mental health status. So I think both pages.
Yes. Yeah.
Okay.
On 23 and on 24, so that's what we're saying, maybe one of them could be services and the other one could be awareness.
Okay.
Yeah.
So 23 would be
Services. No, 23 I think would be services because you're talking about develop a handbook of services available to dental staff, blah, blah, blah.
Okay, and 24 will be awareness. Okay.
24 is the
Okay. Okay. Okay, now we can move on to page 25 is improve prevention and treatment services for substance abuse. Objective is maintain and increase services to meet the continuum of care needs. Our strategies are obtain funding opportunities for universal, indicated and selected population to prevent substance abuse in all populations. Obtain funding opportunities for gaps in treatment services for all populations. Develop resource materials for substance abuse prevention and treatment. And seek federal and state legislative support for infrastructure development to meet gaps in services. Are there any changes, Lucy?
You know, in this section, I would mirror what you have on page 23, where you talk about develop a handbook of the services that are available for substance abuse that includes the credentials of staff as clients or,
Okay. That first bullet?
yes.
Okay. Any other changes? Leo?
I don't know, I mean, part of the problem in this area has to do with residential facilities, and we don't have any in this area or limited. I don't know if it would be advantageous to include that as a specific goal, to increase the number of residential facilities that are available in the Rio Grande Valley as such.
Would that be part of the housing area?
It could be, but these are specifically for those persons that are afflicted with substance abuse, you know, and we just simply don't have very many in the area. We usually have to send them off to San Antonio.
Like transitional housing for substance abuse?
Those kinds of things, yes.
Okay. So that would be to develop housing and transitional housing?
Not just transitional housing.
Or just
it's also,
housing?
Detox centers.
Okay,
you know,
okay.
Things like that as well.
Okay. Page 26 is the continuation of it. I think it's a continuation of the same goal. And the two strategies there, assess and develop evidence-based programs proven effective to the population and develop a provider network to increase services. So any changes to that?
That goal doesn't have an objective. That would be something.
Yeah, okay. I guess it has, the goal is a continuation from the last one.
Continuation on the other page.
Yeah, so it could be the same objective.
So page 25.
Should be the same objective.
Yeah, same objective. We can probably add it there, you know, objective, you know, continue. Okay, the other one, next one on page 27. The goal is promote regional services for veterans in South Texas. Generate support for veteran healthcare programs. The three strategies is support expansion of veterans outpatient clinic and other health services. Identify funding opportunities for veterans and their families, including services for behavioral health and post-traumatic stress disorder. And the other one, support the development of a new veterans hospital.
identify funding and support community-based services for veterans and their families. I think the long-term solution is going to be a regionally coordinated set of community-based providers as well.
Okay.
Getting the different nonprofit organizations in the area to really join hands in this effort.
Okay.
Yes, identify funding and support for community-based services for veterans and their families.
Okay. Yeah, we need to, there's a comment that I made because we were an applicant. We applied to the Texas Veterans Commission for 2 programs. Was for Housing for Heroes and the other one was General Assistance. There were several $1 million that were for the RFP. The only 2 that got funded was the Hidalgo County Veterans Court, $75,000, and Tropical Texas, $200,000. That was it. We applied, we were not approved. But the bulk of the money went to areas north, San Antonio and north. It's sad to see, the number of veterans that we have in the valley, and yet, when we look at the bulk of the money where it's going, it's something that probably we need to really work, hard on doing something. It was just sad when I saw the list. You can go into the Texas Veterans Commission website and look at the grants, who was awarded the funding. There was just a little note. Some advocacy there for our veterans.
So, would it be appropriate, I'm asking a question, okay? Would it be appropriate to put anything in here about the voucher system for veterans? Since we don't have the hospital, in the meantime, there has to be some mechanism, and maybe inclusion or supporting, voucher system for veterans would be one way to continue that. Just simply to state that, I don't know.
Okay. What would you add the bullet as? Develop or?
No, I would say continue to support and enroll doctors to provide voucher system to veterans, something along that line.
Okay. To support or accept vouchers?
Support the voucher system
Okay.
and increase the number of doctors that accept the vouchers.
Okay.
There is a voucher system in place. Unfortunately, there's been some hiccups with the folks that are doing coding and decoding or whatever you want to call it when they do the administering. So there are 5 hospitals in South Texas that accept the vouchers on our veterans' behalf because we don't have a VA hospital. So my thing would be pretty much what the gentleman behind me said. I would probably look at improving the voucher system as it currently exists today because we have doctors in both McAllen and Harlingen that are pulling out specialists like, Dr. Bassett is a bone doctor, orthopedic doctor. These people are no longer, Dr. Nolan Fez, these people are no longer accepting patients because they're not getting paid on a timely basis. I don't know if we could play a resource in trying to make sure that these people are actually getting paid.
Okay.
But it would be probably improving the current existing
Voucher system. Okay.
system that's in place.
And assuring that behavioral health is added to that.
Yeah, well, 1 out of 5 of the healthcare facilities that are being offered, 4 of them are hospitals and 1 of them is a PTSD center. It's the Edinburgh Behavioral Center. So but what's happening is, it is just 1. But unfortunately, because we don't have a hospital and the chances of one of those happening down here, realistically, I don't know if that's going to happen even under this president. And even in the next one, we don't know. But until then, we should probably improve on the conditions or the facilities that are going up, like the outpatient healthcare facilities in Harlingen and the one in McAllen. I don't know how we could do that, but that's where I'd like to focus.
Okay. Yeah, this is not the end. If you go back to your office, you're at home or, drinking a cup of coffee in a restaurant and you say, hey, I should have said that. Feel free and send that over to us. You can send it to me at jgonzalez@lrgbdc.org or, send it to send it to Ken. you feel more comfortable doing that, because you know, we're here and all of a sudden after you leave, say, I should have said that. You know, just feel free and then, you know, give us a call or send us an email to, you know, on any of the issues that we've discussed today, later today, and tomorrow. Last one that I have is increase professional volunteer opportunities to utilize the wealth of experience and talents available in the community. Objective is promote the development, improvement, and enhancement of existing volunteer organizations. Strategies is develop a referral service that will link professional volunteers to the area of need. Develop a clearinghouse of services and volunteers. Identify agencies that need volunteers. Any changes to this? Comments? Additions, deletions? No? Okay. Our implementation process, you know, is, you know, the Development Council, you know, is facilitating the development of this strategic plan. As Ken said, it's every 5, you know, it's for 5 years. We update it every other year to coincide, you know, before the legislative process. And so, you know, but the board timeline, I think that it's set for the board, Manuel, is to be approved by September. Back in the back there, the other later, right now, in a while, we'll have the economic development with Terry Salinas. Will be carrying the rest of this morning. But I think later on, you know, we plan to have a final regional meeting, and that's going to be, if you look at the program at the bottom, the blue part, our final regional meeting is going to be Wednesday, August the 6th, from 9 to 2. And, you know, it'll be, I think, Manuel, it'll be right here at the conference center. And I'd like to, you know, I felt to do this, but I'd like to thank, you know, NAP for allowing us to use the conference center for, you know, for this purpose. And also, I'd like to, you know, also thank our sponsors that are covering, you know, have covered the taping of the session, you know, that will be beneficial for our partnering agencies that were not able to join us. That's all that I have for my section. Like I mentioned, Mr. Gomez.
Joe, you know, since you deal with people themselves and are talking about the elderly, shouldn't we somehow say something about, you know, the community needs to really voice their opinions and what they need? Because what it is, you know, down here in the lower Rio Grande Valley, we're unheard of. We're the last ones to be. Somehow in our strategic plan, we need to get involved and get the communities involved, because they're the ones that need the help. And if they don't get involved politically, you know, it's a political world, whether we like to admit it or not.
Right. That's, I guess, yeah, something that we can look into. You know, like we had some of those yeah, I think there's a goal there on, you know, communities for all ages. You know, part of what we do through, you know, my department, that we convey the message to local communities, is that, you know, we need to be prepared for everyone to age in place, for all ages. You know, their infrastructure has to be set to meet the needs of young families, as they should be ready to meet the needs of an elderly families, because you know, there are specific needs for each population. For our area, you know, we have a very high, you know, compared to other regions, you know, we have a high senior population. You know, we have almost 170,000, you know, 60 plus in our region, and so, you know, we're growing. You know, we're bigger in population-wise for seniors, bigger in Corpus, a lot bigger in Laredo. And yes, you know, we are within, you know, we're kind of in a little corner. I always say we're losing the slogan for Texas of a whole other country, you know, we're a whole other country within a whole other country, you know, in the valley when we look at our needs. Again, you know what, thank you for your input and your comments.